The relaxed restrictions come even as Singapore's weekly infection numbers are still in the thousands. But the task force says that it will take a careful and calibrated approach in its exit strategy. Deborah Wong tells us more.
Well, the task force has really underlined a careful and calibrated approach. Now, this, of course, will have to go hand in hand with higher vaccination as well as booster rates, because the task force says that that's the only way to really keep the situation in check. But again, it also urged all individuals to get vaccinated, especially the vulnerable group, which includes seniors above the age of 70. Now, during the press conference earlier, the task force reviewed some interesting statistics. So for this particular group, the death rate stands at 13.7 per 100,000. Now, for those who are unvaccinated. And for those who are vaccinated, that death rate stands at 1.6. So this really is a vast difference. And the task force says that it underlines the importance of vaccination as well as vaccination differentiated measures. Now, let's hear what Health Minister Ong Ye Kung has to say.
We hope that the number of vulnerable, unvaccinated individuals being exposed to the virus and then infected can be kept low, and our hospitals will not come under pressure. We hope we will not. And it will also be a matter of time before boosters and safe recovery of individuals will increase our population immunity and then bring the infections back down again. And when that happens, the week-on-week ratio will fall below 1 again, and this will give us scope to implement further relaxation of restrictions.
We understand that it is not always easy for people to keep track of the changes in our measures. And from time to time, it also creates frustration because of the perceived flip-flops in our COVID strategy. That's why we are trying very hard to avoid start-stops in our measures and to minimize the need to throttle back or to tighten. But I hope everyone understands it is very challenging to do this. And this challenge is not unique to Singapore. Countries everywhere face the same challenge.